I suffered a spinal cord injury due to a diving accident during a training run, and I had survived to go for it and come back. And then 8 months later, it was a training exercise that knocked me out. I used to play a lot of wheelchair basketball. I coached and I played, and it got to a point where I had suffered rotator tears and didn't want to do a surgery. The VA kept saying, "No, surgically repair your rotators." I had heard from a fellow teammate that he had gone and saw Mr. Coleman and his staff there in San Antonio at the clinic, and I decided to give it a shot. It was just something different with that machine, the POB machine at that time, that they started doing the protocols and increasing the blood flow. And I just felt like I got my recovery and strength back. I started learning more about the devices, and I purchased the PRS. I would put it on 100% and you don't feel it and you think nothing's going on. But the next day, I felt like I had brand new arms, and I said, well, because I got a secret weapon. I tore my bicep completely, and they said, we can repair it. You're going to be out 6 to 8 months, maybe a year. It took 4 months by me going backward for a couple of sessions, and I didn't have to do anything. I just put on the pads, did the protocol, and within months, I was able to lift and move my arm instead of being immobilized for months and not being able to be active. So that's the key thing for me, that it's the acceleration. I always joke around with the therapists at the VA because they're like, your age, spinal cord, and your history of all your traumatic issues that you've had, you're not going to get stronger. I said, guess what? I'm getting stronger. I still ride my bike 25, 30 miles 3 times a week. I'm able to lift. I've gone to magnetic therapy clinics. I've done acupuncture, knee stems. I've done, I don't know how many gadgets the VA would give me to try, and it was more short term. I lasted almost 2 months without going there because of COVID. I told Philly, I don't know what it was, that machine, but it lasted longer than other devices. Yep. It targets something real deep within the tendons and the fibers. And like everything else, it's just, they're dormant. So we light a flame to it and ignite it, and that's what that direct current does. But I would tell any veteran out there, if you want to change your life, give it a shot. I think it's worth the investment.